What is neobladder reconstruction?
Okay, neobladder is new bladder, and we usually use small intestine in order to create a new bladder in most in patients who have muscle invasive bladder cancer. And in these surgeries we first remove the original bladder who is inhabited with cancer cells or cancer masses. Then we have to create another reservoir for the patients where the urine has to be stored. And in today's urologic practice we use small intestine and we create a new bladder replacing the old bladder in order to have a normal cosmetic appearance and at the same time normal functional results.
So in which cases or conditions do patients need neobladder reconstruction?
Mostly we perform neobladder, these new bladders in patients with advanced or muscle invasive bladder cancer. But there are other patients who have some neurologic problems with their bladder where we have to again perform cystectomies, and in these patients, in these neurologic patients, we also perform neobladder. But they are the lower portion. The majority of the patients have bladder cancer.
We know that you are an expert in this particular procedure. How long does it take usually?
That's a tricky question. It doesn't. You should not talk about how long does it take, how many surgeries you should perform. And if you are in a center where there are many patients where you can perform these surgeries, then it takes shorter. I was fortunate enough to be in an academic center where it was mainly bladder cancer center, and so in a short time I was able to perform many surgeries, many neobladders, many bladder cancer surgeries, and that's why I might be called a specialist in this area.
Are there any factors that can affect the outcome of the surgery?
Sure, the most important thing is surgeon's experience, and the second most important thing, the experience of the whole team. It's not a one-man show. It's a complex surgery which has been performed with the whole team, and not the surgery plus the preoperative evaluation is critical, and postoperative care is most critical part of these neobladder reconstructions.
Can patients do urination normally as before? What are the possible changes that they might experience?
Okay, we should not talk about a normal urination. It's a new normal urination where the patient has to learn. And in a good center, and I can call our center a good center, our goal is not only operate these patients, we also teach them in the postoperative period how they can use their new bladder, because the sensation of this new bladder is not like the previous one, because you create a new reservoir from the intestine, and the sensation, the neurologic and the vascular details are so different. So you have to learn how to use these new bladder.
How often a catheter would be needed after the surgery?
We usually leave the catheter for 3 weeks. After 3 weeks we remove this catheter, and then we start to teach these patients to how to use their new bladder, and it takes time, but people usually learn how to use it.
Can neobladder be lifelong, or another surgery might have to be performed in a certain period of time?
Our goal with this surgery is to achieve a reservoir, a new bladder for the rest of their lives. But it's a complex surgery, and because it's a complex surgery, afterwards patient has to deal or adapt with this new bladder. So if the patient adapts with the bladder, and if the surgery was acceptable, then it's a lifelong reservoir. In other instances, we have to sometimes reoperate these patients, but usually it's the teamwork together with the surgeon, with the surgical team, and with the patient.
Thank you.